It is Monday, December 2nd, 2024. We are on day 2 of 31 days of AI Magic, Simple Solutions for Everyday Living. So today, my challenge with everyday living is that I'm having cataract surgery this morning, because that's what happens when you get OLDER. So anyway, I had the first one one eye done a couple of weeks ago, so this is the second eye. And so I figure it's going to be about the same as the first, and I know what to expect, but I want to ask ChatGPT some questions about this surgery and also things that I'm not using Chat in place of going to doctors. There's certainly some interesting information here, but I check everything that I find or anything that I learn from AI tools. All right, so the first question I will ask today is the second cataract surgery easier? You don't have to be perfect speller, by the way. I do this because it drives me crazy to see spelling errors, but you can usually read much of what you're saying. Is it easier or harder than the first? Okay, so it might be easier. Okay, so the trick is, so there may be some imbalance in vision during recovery. After 1 week on the first eye, you go to see the optometrist, not the surgeon, but the optometrist, who just checks to make sure you're okay. And he described the process to me as the 3 steps in the surgery as the excavator, which is like the jackhammer that goes in and breaks up the cataract. And then there's the vacuum cleaner, which goes in and sucks it all up. And then there's the insertion device that places the lens on your eye. So this does not sound great for me. I don't know if I'm going to be thinking about jackhammers when this person is approaching my eye with some sort of sharp device. But anyway, so here's a question I had. Why is it not good to bend my head over for the first few days? Does that mean I can't load the dishwasher? Okay, so bending at the waist for the first 2 days because of pressure changes in your eye. Ask someone else to handle this task for the first few days if possible. I like that. Okay, so here's another question I have. Why do we fast as if we're having major surgery for cataract? Typically required because of the anesthesia and safety protocols. So you do get sedation. It's not much of a sedation at all. Okay. Oh, avoid nose bumps. Fasting is precautionary for all procedures where sedation or anesthesia might be used. All right, fine. So although it's minimally invasive, the risks associated with anesthesia are taken seriously. And then my other question is, how long after second surgery do I get checked for new glasses? Will I need them for sure? So I'll just tell you, say that when you see this little arrow come up in the middle of your screen, that means there's more information. So that's what you click on. Your eyes need 4 to 6 weeks after the second surgery. Whether you'll need glasses depends on. Oh yeah, so they have premium lenses that I think this is like the equivalent of LASIK surgery for cataract surgery. I just went for monovision because that's what I'm used to, and I'm a reader, and so if I had to choose between being able to see distance and seeing up close, I would always choose for up close and then wear glasses for distance. So anyway, that's what I'm doing. So if I say I'm a little nervous this morning, how safe is the operation? ChatGPT will comfort me here. One of the safest and most commonly performed procedures in the world. And here are some facts to reassure you. Okay, great. Oh, and there's more. Oh, and then they're telling me why it's safe. Local anesthesia, small incision, how to feel more comfortable. Yep, I don't hesitate to ask my surgeon. Anyway, so this is a good idea of this is nothing major. This is 5 minutes that it's taken me to come in here and ask these questions. I can ask some of them to the surgeon, but at least it gives me a background so that I feel like I'm prepared. And So anyway, that's my plan for today. I will see you tomorrow. Huh. All right. Have a good day. Bye.